Hello, everyone. A very good afternoon to all of you. I'm Sayukta from Bladder Wellness Team, and I'm sure all of you must be doing really good. Today, we are going to discuss on a very important topic renal stones. बहुत आम भाषा में जिसे हम किडनी स्टोन्स कहते हैं ये hard stone like pieces होते हैं that can form in one or both of your kidneys. This happens when high levels of certain minerals starts accumulating and crystallizing. These stones vary in size and shape. They may be as small as a grain of sand or as large as pea. Some kidney stones reported are as big as a golf ball. A doctor, such as a urologist, can treat kidney stones and prevent further problems such as a urinary tract infection, commonly known as UTI. So, to throw more light on the subject and guide us further on the details of kidney stones, today we have with us renowned urologist Dr. Rakesh Maan joining us from Sirsa, Haryana. Dr. Rakesh Maan is MBBS, MS, MCH in urology. He is a consultant urologist as is currently practicing at Suraksha multispeciality hospital, Sirsa, Haryana. A very warm welcome to you, Dr. Rakesh Maan.
Good afternoon. Good afternoon, everyone.
डॉक्टर आज हम किडनी स्टोन पर बात करने जा रहे हैं और बहुत कॉमन होता है किडनी स्टोन बहुत आम सुनने को मिलता है कि किडनी स्टोन हुआ है किसी को और एक बहुत आम बात जो उसके साथ सुनने को मिलती है वो ये बहुत तेज पेन होता है जिसको भी किडनी स्टोन एक्सपीरियंस होता है तो इस पर हम डिटेल में आज इस पूरे सेशन में बात करेंगे कि किस तरह से बचा जा सकता है अगर हुआ है तो क्या करना है मोस्ट इम्पोर्टेंटली क्या नहीं करना है तो सबसे पहले डॉक्टर इस सेशन की हम शुरुआत इसी से करना चाहेंगे किडनी स्टोन्स रीनल स्टोन्स है क्या
Kidney stone, it is not a stone, it's a crystal that is deposited in due to lack of water. It sediments and then ultimately it form a stone.
ओके
Yeah.
डॉक्टर किडनी स्टोन की जब भी बात होती है तो सबसे पहले सिम्टम्स पर लक्षणों पर भी हम बात करना चाहेंगे व्हाट आर द मेन सिम्टम्स ऑफ किडनी स्टोन
The main symptom of kidney stone, they are the most common symptom, the most patients present with is pain in abdomen, pain right flank. The second most common symptom associated with renal stone is hematuria. Patient is complaining of bloody urine. The third most common symptom associated with renal stone is urinary tract infection, fever. Um, these are the most common symptom. They are associated with the renal stone.
बिल्कुल तो बहुत बार आमतौर पे किडनी स्टोन जब होता है तो बहुत तेज पेन होता है और खासकर बैक की तरफ जहाँ किडनी की पोजीशन होती है वहाँ बहुत तेज पेन होता है और कहते हैं कि कुछ ऐसी बीमारियां हैं जिनमें तेज पेन होता है ऑलमोस्ट अनबियरेबल हो जाता है वो पेन और वो उनमें से एक है किडनी स्टोन तो बहुत तेज पेन होता है हेमेचूरिया यानी यूरिन के साथ कई बार ब्लड आता है कई बार यूटीआई होता है बुखार आता है तो इस तरह के लक्षण होते हैं डॉक्टर किडनी के जो स्टोन्स हैं वो होते कैसे हैं आपने कहा क्रिस्टलाइजेशन का प्रोसेस हो जाता है और उसकी एक बहुत आम वजह है कि पानी का कम होना या पानी ठीक से न पीना एडिक्वेट वाटर इनटेक न करना तो किस तरह से किडनी स्टोन्स जो है ये फॉर्म होती हैं
Actually, generally, छोटे छोटे crystal, the small crystals, they, we take calcium, oxalate, phosphate uh, in form of diet. Uh, Generally, these crystals they flush out with the water. But when we take inadequate amount of water and more than normal amount of these minerals, calcium, magnesium, phosphate, oxalate, then when the saturation that the amount of the crystals exist more than the saturation of um, these minerals, then these minerals sediment and they form stones. There are very four type of stones are there. The most common stone is calcium oxalate. The second one is the phosphate stone, calcium phosphate. Third, uric acid stone. Fourth is this cystine stone, formed due to medicines, etc.
बिल्कुल। तो ये अलग अलग तरह के स्टोन्स हैं जो फॉर्म होते हैं, जो क्रिस्टलाइज होकर किडनी में पाए जाते हैं। डॉक्टर, हम सब जानते हैं कि जो यूरिनरी सिस्टम है हमारी बॉडी का, उसमें किडनी है, उसमें ब्लैडर है, उसमें यूरिनरी एक तरह से जिसे हम कहें जो ट्यूब है जो यूरिन को कैरी
Ureter.
करती है, यूरेटर है। तो किडनी में अगर स्टोन होता है, क्योंकि आपने एक बार ये भी बताया था शुरू में कि यूटीआई भी कई बार हो जाता है किडनी स्टोन की वजह से, यानी यूरिनरी ट्रैक जो है वो भी, उसका भी इन्वॉल्वमेंट कई बार हो जाता है। तो ऐसे में अगर किडनी स्टोन होता है तो क्या वो इस पूरे यूरिनरी सिस्टम को भी डिस्टर्ब कर सकती है, और अगर करती है तो किस तरह से?
The kidney is 24-hour. The main function of the kidney is to produce urine. Kidney is 24-hour non-stop producing the urine, and when stone, it get impacted in path of the urinary tract. Generally, kidney is producing urine, then it travels in the ureter, then it reaches in the urinary bladder, then from bladder it moves out of our body through urethra, um, in male penile urethra and female, and when the stone get impacted in the path of the or urinary tract, then accumulation of the urine starts, and there the bacteria grows, and they produce toxins, and if we do not remove the obstruction, then it can cause sepsis, it can permanently damage the kidney, and in rare cases it even can cause septicemic shock, even death. So we should not neglect the kidney infections. Any patient who is having fever due to urological regions like pyelonephritis or due to infection due to stone, he should take it as a serious disease and should get admitted in the hospital. He or she should not ignore these symptoms.
Right. So please do not ignore these symptoms. If you have extreme pain in your abdomen, or you have, UTI, fever, nausea, hematuria, please go and consult a doctor, and please go to the right person, which is a urologist. So don't ignore the symptoms. If left untreated, it can be really fatal to us. Now, डॉक्टर, किडनी स्टोन्स पर हम लगातार बात कर रहे हैं, और मेडिकल साइंस में एक बहुत अच्छा फ्रेज है, कहा जाता है प्रिवेंशन इज ऑलवेज बेटर देन क्योर। सो एनी वे वी कैन प्रिवेंट फॉर्मिंग किडनी स्टोन्स?
Yeah, if patient is having stone formed the first time, he should get investigated. He should done 24-hour urine analysis. He should get a USG done, and he should get stone analysis done, and from which we get information about the chemical structure of the stone. And following that, we can advise him the recommendations, what diet he should take. We can change the diet according to the type of stone, and we should guide him to take adequate amount of water. It different
Right.
depending on the
As you said,
different.
yes, doctor, please continue. Please carry on.
Uh, Depending on the composition of the stone, we can guide him different diet. For example, in uric acid stone, we guide him to eat protein less. In calcium oxalate stone, we should guide him to take oxalate rich diet less, mm, like such. There is no single solution to each and every stone. For every patient, every different stone, we have to guide him different, guidelines.
Right, right. So, what is the formation of the stone, whether it's oxalate or calcium, etc., it depends a lot on that. What kind of treatment, what kind of dietary precautions, etc., is to be given. So it's important to get it diagnosed uh, with a with an expert, with an urologist. तो डॉक्टर, जैसा कि आपने कहा कि किडनी स्टोन के जो लक्षण हैं उन्हें इग्नोर नहीं करना चाहिए, डॉक्टर के पास आना चाहिए। आपने ये भी कहा कि adequate water intake is very important or adequate liquid intake is very important. But in our society, on a practical ground, we see people having more of caffeine, more of tea, more of other things in liquid as compared to other healthy things like water, coconut water, juices, etc. So, क्या आप सजेस्ट करना चाहेंगे? अगर कोई बहुत कॉफी पी रहे हैं, बहुत चाय पी रहे हैं, तो क्या उसे भी लिक्विड कंजम्पशन में माना जाएगा या ये खतरनाक हो सकता है किडनी स्टोन्स के लिए?
Scientifically, we do not have any evidence that coffee, due to intake of coffee or tea, it can um, stimulate the formation of stone. We do not have any scientific evidence to prove that. But yeah, there is this is simple thing. मतलब कि adequate amount of water is definitely help in the prevention in the formation of stones.
Okay. So adequate amount of water is very important. It can prevent you from having kidney stones. अगर kidney stones हो जाता है doctor, when a person comes to you with extreme pain or any of the symptoms that you have mentioned, और कई बार ये भी होता है कि हम annual एक checkup के लिए जाते हैं, medical checkup के लिए, और वहाँ पे जब हम अल्ट्रासाउंड कराते हैं या फिर सीटी स्कैन्स होता है, तब हमें पता चलता है कि स्टोन भी है। तो ऐसे में फिर हमें रिकमेंड किया जाता है कि हम किसी यूरोलॉजिस्ट से संपर्क करें। तो इन दोनों ही केसेस में सिर्फ लक्षणों के साथ जब कोई पेशेंट आपके पास आता है या फिर सीधे रिपोर्ट्स के साथ आते हैं, तो किस तरह से आगे का डायग्नोसिस होता है, आगे की क्या प्रक्रिया होती है?
Ma'am, not all the stones are symptomatic. Uh,
ओके।
all stones do not cause pain, hematuria, and recurrent UTI. Mm, mm, Small stones like 2 to 3 mm, they if they do not get impacted in the ureter, then they do not cause any symptoms. And when a patient comes in our OPD or clinic with symptoms, though we first take history from him, proper history. Then we will advise him some routine investigations like complete blood count, renal function test, imaging of abdomen. Then, depending upon the urine complete examination and depending upon the result of these reports, we guide him further. The small stones, they do not need any surgery. Stones less than 5 mm in kidney, they generally generally do not require any surgical treatment. They are removed from our body. They can remove from our body with the help of medications known as medical expulsion therapy. And then, depending upon the size and location of the stone, we advise different surgeries and different procedure to the patients.
बिल्कुल, तो अगर स्टोन का साइज़ छोटा है, 5 एमएम से कम है, तो कई बार सिर्फ़ मेडिकल मैनेजमेंट से ही अ, मामला ठीक हो जाता है, केस ठीक हो जाते हैं, स्टोन्स निकल जाते हैं। कई बार स्टोन्स छोटे-छोटे स्टोन्स का फ़ॉर्मेशन होता रहता है, लेकिन जब आप लिक्विड इनटेक रखते हैं, एक अच्छी लाइफ़स्टाइल अपनाते हैं, तो कई बार उससे भी फ्लश आउट हो जाता है। लेकिन फिर भी ज़रूरत इस बात की है कि अगर सिम्पटम्स हैं, तो हम डॉक्टर के पास जाएँ। अगर किसी और तरीके से पता चला है कि किडनी में स्टोन है, तो भी हम एक रिनाउंड यूरोलॉजिस्ट से संपर्क करें, ये बहुत ज़रूरी है। डॉक्टर, आपने कहा कि 5 एमएम से ज़्यादा का जब स्टोन होता है, बड़ा जब स्टोन होता है, तब उसमें अलग-अलग तरह से मैनेजमेंट होता है। अच्छा, पहले तो ऐसा होता था किडनी स्टोन हुआ है, तो सब इसी बात से घबरा जाते थे कि अब सर्जरी होगी, और पहले सर्जरी का मतलब चीड़-फाड़ माना जाता था। लेकिन अब जिस तरह से हम देख रहे हैं, टेक्निकल एडवांसमेंट्स हो रहे हैं, मेडिकल साइंस बहुत-बहुत एडवांस हो चुकी है, और अब तो रोबोटिक्स का भी इस्तेमाल यूरोलॉजिस्ट बहुत कर रहे हैं। तो जो लेटेस्ट टेक्निक्स हैं, उन पर अगर आप थोड़ा प्रकाश डालें।
In the earlier era, open surgeries in form of incisions. They were used to remove the stones. But in nowadays, the open surgery they are rarely used in very large stones. They are used mainly endourology and laparoscopy. They are now taken big advantage. Routinely, we are using energy sources in the form of laser, in form of RIRS, URS, PCNL. So there is definitely change. We can have now less pain. And different main instruments have come up that lead to less complications, less pain, less bleeding. So the advancement they really changed the whole the scenario. We are much better now than earlier 30 40 years ago.
Absolutely. We are much better right now with all the technical advancements. And as you said, now the surgeries are laser or various other techniques are there. We have also heard that normally, in a way, we crush the stones and it naturally get flushed out. Would you like to shed some light over that, how that technique happens?
In MA, actually, there are 2 to 3 procedures that are used for removing the stones. In kidney, if the size of stone is greater than 2 centimeters, then generally we use PCNL. PCN full form is percutaneous nephrolithotomy. In this, patient is laid in the prone position, and then once around 1 centimeter, the hole is made in the back, and then we reach the kidney, and then with the nephroscope, we um, broke the stone in small pieces, and then with the help of forcer remove the stone. The another one is URS and RIRS. In URS, in full form is ureteroscopy. RIRS is reverse intrarenal surgery. In this, we reach in the it is RIRS is generally used for stones less than 2 centimeter in kidney, ureter. In this, the stone is broken in just dust and is flushed out with the water, and we put DJ stunting after this procedure. In this, laser is used and flexible ureteroscope they are used. It is without any incision, no incision used in this patient, and generally these are day procedure. We can discharge the patient within 24 hours or after 24 hours. And generally all the
And
urological procedure they are done in spinal anesthesia. Patient remain awake during this procedure.
okay. And how much time is required during for the recovery?
Generally, we discharge the patient within 24 to 48 hours, and patient can do normal light work after 2 to 3 days, and he can join the office after 1 week.
Okay, so there's nothing to worry with all the advancements, technical advancements, and medical science. Surgeries are now very effective and very easy, and less pain, of course. And you will get back to your normal track life within a week. I mean, you can do your chores in 2 3 days, but ऑफिस जाना है, दूसरे काम करना है, तो भी आप एक हफ्ते में उसके लिए पूरी तरह से फिट हो जाएंगे. एक हमारे व्यूअर है अभिषेक, उन्होंने एक सवाल भेजा है, कैन अ यूरिन टेस्ट डिटेक्ट किडनी स्टोन्स?
Urine test can only tell about the urine. It can detect crystals. We can have some idea about it. In renal stones, we can have crystals in the urine examination. But it is not a good test for detecting the renal stones. Imaging in form of ultrasonography is the first investigation to diagnose the renal stones. Some stones which are present in the lower ureter, they are not visible on the ultrasonography. So, non-contrast CT scan KUB is the gold investigation for renal stones. It 100% it can tell about the renal stones.
Okay.
It can give
डॉक्टर हम लोग लगातार किडनी यस डॉक्टर प्लीज कंटिन्यू
urine complete examination. It give very less idea about the renal stones. Only it can tell us about the presence of WBCs, the RBCs, proteins, ketone bodies, crystals in urine. So it does not give any useful information about the renal stones.
ओके Dr. Mann, we also see a lot of recurrence in kidney or renal stones. For example, if a person is diagnosed with kidney stones, there are high chances that recurrence of kidney stones or he will develop a tendency of stone formation. Why it happens, how to prevent it, how to get treated.
Generally, within 5 years after the diagnosis of first time renal stone, the recurrence is around 50%, 40 to 50%. If we do not follow the guidelines, we do not change our dietary habits, and if we do not change our lifestyle, and there is chances of 40 to 50% recurrence within first year of the diagnosis of first renal stones. So for that, for the prevention of the recurrent renal stone, we should thoroughly investigate our blood. We should go for stone analysis. We should go for our serum potassium, serum magnesium, serum calcium, serum phosphorus, citrate, oxalate levels, 24-hour urine collection, 24-hour urine pH, 24-hour urine thorough analysis, and depending on the results we can guide the patient to prevent the formation of recurrent renal stones.
Right. So, in case you have it for the first time, you get renal stones for the first time, be very careful, get it treated properly, and be in touch with your doctor so that recurrence can be managed. Recurrence of kidney stones can be managed. Now, doctor, many times we hear as a layman, there are so many theories about kidney stones. Many times people say having beer or alcohol can get rid of kidney stones. Many times people, because they have this fear of getting it operated, going under the knife, etc., though you have already explained that how easy the surgery part is these days, but still people are so scared they go for other therapies. Many a time people will make an umbrella list. They will avoid having eggplants, brinjal, tomatoes, anything with seeds, okra, etc., and they say that this is the healthiest way to go ahead. But as you said initially that there are different kinds of stones and their formations are different, and as per the formation we tell the dietary precaution. तो ऐसे में क्या करना चाहिए? कई बार दूसरी थेरेपीज या दूसरी तरह के नुस्खे अपनाकर लोग बहुत डिले कर देते हैं और स्टोन का साइज बहुत बढ़ जाता है और दूसरी तकलीफें जिसका आपने शुरू में भी जिक्र किया था वो होने लगती है। तो क्या आप सजेस्ट करेंगे लोगों को?
Uh, I have seen a lot of patients, they are trying different local therapies, and ultimately, I have seen we have to do a lot of nephrectomies. We have to remove their kidneys because the time they reach our hospital or clinic, the kidneys function goes. It is like non-functioning kidney. So I want to tell them, please do not ignore the kidney symptom. Many of the people in the many of the local doctors, they in villages they tell that this stone will be removed by this technique, this magic. There is as such no magic available with us. We, if the size of the stone is more than 1 centimeter, surgery is the only treatment. Whether you are in India, you are in UK, you are in USA, this is the only treatment available. Otherwise, your kidney that will slowly start deteriorating. And some people they say ki 2 months we have the pain in our kidney in the abdomen. Now after 2 months we have no pain. They forget that at that time the kidney was functioning, and at now after 2 months the kidney has started non-functioning. So they have misconception in their mind ki the stone has been removed, the stone has gone, the stone has passed, but in actuality it is not so. The pain goes because the kidney become non-functioning. So I want, kidney is a very vital organ. If our both our kidneys starting less function or non-functioning, then we have to go to dialysis. Kidney is, do not ignore kidney. Kidney is a very vital organ. It is essential for our living.
Right. Kidney is a very vital organ. We need to take care of it, even if we have two kidneys. But it's important that we take care of both the kidneys and make such, environment, give them such environment that both of the our kidneys work well. We are getting so many questions from our viewers. One more question by Anil Kumar. His question is: should salt intake be reduced to prevent kidney stones?
Yes, if depending upon the composition of the kidney stone, so so, and which depending on the cause of the renal stone, why we are having this stone, whether we are having hypercalciuria or hyperoxaluria, depending upon the composition and the biochemical profile of the patient. In some patients, we can reduce the some particular salt, but in generally in general terms, we can't know. There's such a guideline ki for this stone we should reduce depending on that patient, what is the cause of the stone and what is the stone analysis of that patient. We can guide that patient accordingly.
Okay. Fair enough. We have Raju with us, and his question is: does too much calcium cause kidney stones?
Yeah, it can cause
Hmm.
kidney stones, but it is not only the reason. There are some other hyper. If patient is having hyperoxaluria and some, then it can cause stone. But not in every case, calcium can cause kidney stone. It it should be with some other biomolecular molecular abnormality that can cause stones.
Okay,
Only
okay, doctor.
single hypercalciuria cannot cause stone.
Okay. Many times we hear people saying that don't take calcium supplements or don't take too much of calcium supplements. But the fact is that in our society, with our lifestyles, etc., eating habits, many of us are dependent on calcium supplements. Even women, after a certain age, they are advised to take calcium supplement on a regular basis. But then, as again I said, in the layman's community, we get to hear so much that don't take calcium supplements, otherwise kidney will suffer with stones, etc. So what's your view on that?
Mm, Depending upon the symptoms of the patient, uh, if we in old age, in general in females, due to hormone deficiency, osteoporosis happen, the bone weakens. So orthopedicians and physicians and gynecologists, they often advise calcium to strengthen their bones. So it is not a contraindication. We should give calcium, and if we will check the level of the serum calcium, serum oxalate, and all other the blood parameters, then we can tell accordingly to them. In general terms, the calcium we can give them calcium for, and it is not a right thing to say that giving calcium is
Right. So it's like a myth that consuming calcium supplement can lead to kidney stones. The best way is to get an advice from your doctor. If your doctor is suggesting you to have some kind of supplements, it's okay. Don't do it yourself. Don't self treat. And again, if you have any trouble, please go and consult the right person, which is doctor again. One more question by Deepak Saxena here, doctor, and his question is blood in urine a sign of kidney stones?
Yeah, it can be a sign of kidney stones, but hematuria have many causes. The other causes should be ruled out. If it is a painful hematuria, then we can tell that. If it is a painless hematuria and patient age is above 60 years and patient is having smoker, then we should go to some other disease. It is a sign of CA bladder. Painful hematuria can present in the renal stone, but painless hematuria above the age of 60 years in a smoker patient, it is typical of carcinoma bladder.
Okay. So, with pain, without pain, you have to be very cautious. You need to get it checked properly. Don't waste your time. Don't ignore the symptoms. Now, doctor, talking about dietary precautions, as you said, diet, your liquid consumption, your lifestyle, it all plays a very important role in maintaining your good health plus good kidney health. Now, when we talk of diet, what should we include, what should we exclude in case we are a patient of recurrent kidney stones?
So the first important thing about diet, adequate plenty of waters, around 2 to 2.5 liter. We should that much of urine output. And the second one is we should avoid tomatoes in recurrent calcium oxalate stone formers, because tomatoes they are oxalate rich. The other one is in the uric acid, recurrent uric acid stone formers. We should avoid animal proteins. We should reduce the amount of animal proteins. In recurrent in in calcium ammonium phosphate stones, they are also called staghorn or infection stones. We should take precautions to prevent recurrent urinary tract infections and some other disease, obesity, metabolic syndrome, diabetes, recurrent UTIs, drug induced stones, and patient having anomalic anatomic abnormalities. We should treat all these conditions. And among the dietary, I have told, depending upon the stone composition, some are oxalate. In calcium oxalate stones, oxalate rich food is avoided, like tomatoes, and then chocolates, and then uric acid, mainly animal, non-animal, vegetable protein, that should be decreased. The consumption of the protein should be decreased, and in uric acid stone, we should take alkalizer, citrate rich like lemon, this to increase the pH of the urine, that is responsible for the uric acid stone formation. And some other general practice, we should try to reduce the amount of weight. We should exercise. We should reduce the amount of um, um, BMR. We should try to correct BMR. We should try to control diabetes. These all are preconditions. All are preconditions that help in the formation of stones. If we are having any anatomic abnormality, then we should correct it with the help of surgery or some surgery or some other maneuver.
Okay, so a healthy lifestyle goes a long way in maintaining good kidney health. So, in case you want to have both your kidneys functioning well, please have adequate water, have plenty water, eat well, and in case you had a history of stones, renal stones, get it checked what kind of stones, and accordingly, the precautions will come to you from the doctor. Now, doctor, as you said initially, if the stone size is not that big, if it's less than 5 mm, then normally through medical management, stone is flushed out. But then we don't know many a times whether it's out or it's still inside. What is the normal duration after which we need to get it checked, whether the stone is there or not?
First of all, if you are having pain, if the pain decreases, uh, then around if the pain decreases, then we can have some idea, if the stone has passed. Then we can do repeat ultrasonography, insistic KUB to confirm the stone has passed or not passed.
Right. Dr. Rakesh Maan, before we sum up the whole session, before we conclude the whole session, any take home message? And once again, if you would like to shed more light on what are the symptoms, how to prevent, in case it's there, how to get it treated, in short.
Okay. Kidney stones, they are very common. Generally, they are present in the dry, arid areas of India like Rajasthan, uh, Haryana, Maharashtra. Patients generally present with flank pain, hematuria, recurrent UTI. Patient Once the patient is having the attack of renal pain, we should some consult some urologist and undergo some investigation, imaging in form of ultrasonography, X-ray, KUB, CT scan, some routine investigations in form of complete blood count, renal function test, urine complete examination, urine culture. Then, depending upon the result of these reports, we should get treatment from a urologist. Mm, Depending upon the size of the stone, the location of the stones, and patient profile. There are minimal invasive procedures nowadays in urology for removal of stones. These procedures they have produced wonderful results. Patient will face no pain even during the procedures and even after procedures. Surgery result they are very good. You the you There is no need to face pain. Nowadays, RIRS laser, the with the help of RIS laser, we can remove the stone without any incision. And generally, patient they can join their office within 4 to 5 days to 7 days after the operations. And if and do not ignore the symptom of the kidney. Kidney is very essential, very vital, life life-saving organ. If you will ignore the kidney symptoms um, for a long time, then kidneys they get deteriorated, and uh, we have to face serious consequences for that. For ignoring small problems, kidneys can we can have infections, we can have pyonephrosis, we can have pus in the kidney, and we can our kidneys start in non-functioning, poor functioning. We can have fever, and generally, if we keep ignoring kidney, we have to go for dialysis, renal transplant, like so. Stone, renal stone is very. Do not ignore the renal stone. It is easily curable if you reach to your consult your urologist on time. And for the recurrent stone former, I want to advise to go for the renal stone analysis for the thorough biochemical workup of serum, phosphorus, calcium, magnesium, and then we have to follow the guidelines which are um, told to us by the treating urologist who has seen your renal stone analysis, and we have to drink plenty of water, avoid the foods which causes stone, depending on the stone composition. And
Right. So it's important to take care of your health. It's important to take care of your kidneys. So in case you have stone, please don't ignore the symptoms. Go and consult the right person, which is a neurologist. Thank you so very much, Dr. Rakesh Maan. It was wonderful talking to you. Thank you for your valuable time and making this whole session so informative. Thank you.
thank you, thank you,
Thank you, Doctor. And
thank
viewers,
you,
thank you for your excellent participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.
thank you.